Tablets and spoonfuls. How to manage your drug hobby. Taking medication while at home. Correctly taking your meds will help your syndrome. Tablets and spoonfuls. Hosted by Quick Care Pharmacy.
All right, ladies and gentlemen, welcome to another program, Tablets and Spoonfuls, on your radio, Wednesday morning, that time again, that special time when we meet on radio. Martha Augustus is in the house as usual. Martha, good morning to you.
Good morning to you, Felix. Welcome to another Wednesday morning of Tablets and Spoonfuls.
Another beautiful Wednesday.
Yes, and good morning to our many listeners tuned in this morning.
Yes, we say special good morning to our listeners and those joining for the first time. We want to say welcome to. And the purpose of this program, of course, the objective is to make sure help you manage your medication at home properly. And so we look at different topics, all kinds of topics that will interest you. And thankfully you've been listening and been learning. I myself been learning, and so we are grateful for that. Now today on today's program we have two winners. You know, every week we speak about the promotion at Quick Care Pharmacy, and all you have to do is get your prescriptions filled at Quick Care Pharmacy. Your name goes into a box, and at the end of the month you choose two names, and these two people get $100 each. That will go towards the next doctor's visit. And our winner for the month of June is from the north of Dominica, David Basil, Portsmouth. All right, so Portsmouth has a winner, and that's David Basil. And we go right down south, close to South Castle Comfort. Next winner is Joseph Tita. Joseph Tita. These two gentlemen fill their prescriptions at Quick Care Pharmacy, and they're getting $100 compliments Quick Care Pharmacy, and that will go towards your next doctor's visit. This month is two men.
Yes, that's right. I was just trying to tell you that.
Yeah, ladies, your turn next month. Okay, get your prescriptions filled at Quick Care Pharmacy, and you get an extra $100 that goes towards your doctor's visit. And I'm sure that'll be helpful for somebody out there. Right, Martha?
Very true. We could not have said it better. So I want to congratulate Mr. David Basil and Mr. Joseph Tit for being our month of June winners. We're happy that we can give back to you as you give to us. So keep shopping. You may be lucky again next month.
Who knows? All right, so of course this program is brought to you with the kind compliments of Quick Care Pharmacy. Let's get a message from Quick Care Pharmacy.
Meet Moshe Zalbot, a retired Dominican who spent most of his working life in England but is now back home. Lewe kumasi palikot Quick Care Pharmacy, Anglais. His English flows straight from Mon Anglais to Mon Macac. Edimo, I was have a sickness, but I was getting good medicine in England. So when I come here, I thought I was to die. But I uncover a place called Quick Care Pharmacy, Cote Halsborough, and I observe the whole thing about Quick Care Pharmacy is better health care for everyone. I get professional service and advice. Drug education is a pharmacy you can trust and put your confidence in. I can talk about anything, no fear. I get quality products just like in England. Free blood pressure checks. Products to lose weight because, as you can see, Motogua, I save money. I get my discount card and they always well stocked. If I could take Quick Care, you have a knowledgeable team providing 21st century service. Quick Care Pharmacy just makes me feel better. And of course, I get my little booster when I need it. It makes you crow like Okiyoko.
Welcome back, ladies and gentlemen, to Tablets and Spoonfuls on your radio. And of course, another new topic today. We just want to share with you today. And so we invite Martha Augustus, Doctor of Medicine, to lead that discussion. Martha, take it away now.
Okay, so today we want to look at something a little different, but it all ties into managing your therapy at home. So we're not going to look at any drug in particular. We're not going to call the names of drugs. Maybe one might be called, but that's just to help with the discussion. So what we want to look at today are factors that can spur new side effects after having used a drug or drugs over a period of time. You might wonder, why is it that I have been using this drug for so long and this has never happened? Why it just suddenly started happening? So we want to look at a few factors that can help understand why that might be happening. And
These things actually happen. Using a drug for a good while, and afterwards suddenly
you might develop some
develop some
unpleasant
reaction,
side effect or reaction, and it will be interesting to discover some of the factors that can cause that, and you will see why this can happen. So there are a number of factors that impact whether you'll develop new side effects. Some factors include, like we say, ebbs, which is a decline, and the flow in our own body's basic biology.
Ebbs and flow.
Ebbs and flow. The way you metabolize a medication can simply change over time. It can simply change over time. For instance, you could tolerate amoxicillin for many years and then suddenly develop bad stomach issues while taking it at a later date or at present time. And this particular shift can be chalked up to what we call the age. It's an age factor.
Because you get older, it can affect you.
Yes, and we will see why, because our metabolism decreases over time, meaning that the body doesn't get rid of it as fast as it used to.
When you were younger.
When you're younger, leaving a higher concentration of the drug in the bloodstream. And that increases the likelihood of developing some of those unpleasant side effects. So we see here that age is one of the possible factors why that can happen.
That's one time when you can't see age is just a number.
Yeah, that's true. Okay, so we have changes in the liver or the kidney. So any change in your liver or kidney function is another factor. For instance, a condition like diabetes, and that can decrease the kidney function, which will cause the drugs to metabolize slower, thus increasing the risk of that side effect that is unpleasant. So lifestyle or physical changes can also affect the odds of developing some of those side effects. A change in the body's fat may increase the likelihood of a medication reaction down the road. So as Felix said earlier, when we were younger, we cannot metabolize the same way as we get older. And one of those factors could be an increase in weight, which doesn't necessarily equal age, but age plus an increase in weight, because the body's metabolism slows down, then you're able to store much more fat, and so that can increase the weight gain, and that can certainly change the way that the drug is metabolized in the body. Because some drugs are what we call lipid soluble, meaning that they can only dissolve in a fat medium, and they may concentrate in fatty tissues only, so that's where they will store, okay? And such as some drugs like maybe anti-anxiety medications, that means you need to get a lower dose to avoid those side effects. So if you're using that drug, have been using that drug for a while, and we have those changes in the body over a period of time, eventually you need to be assessed by your doctors, and maybe they have to decrease the dose so that too much of that drug does not concentrate in the fatty tissues. And
that is why I suppose it's important to visit your doctor regularly.
That is why
changes in your body, and what happened 6 months ago or a year ago may not apply today.
Very true. Very, very true. Very, very important, because some people try and avoid visits to the doctor because it's costly, and they figure, okay, well, this is what I've been using for years, so I'm going to continue, irrespective of if I see the doctor or not. It's going to manage my situation. But then you discover that over time you're still having the same high sugar, high fat, high cholesterol, whatever the situation may be, and question why is it this is happening. These are some possible factors that could allow that to happen. For example, how much you're drinking and what you're drinking. Example, alcohol, which we always speak about on Tablets and Spoonful, is another concern. Some drugs have the side effect of increasing the amount of salt your body retains. You may need to stay well hydrated to keep that side effect at bay. And so, in addition, many medications, like we've spoken before, they metabolize in the liver. We're still focusing on the alcohol. Many medications metabolize in the liver. just like alcohol. So alcohol, what it can do is increase the side effect of certain medications because the liver will metabolize the alcohol before the medication. All right? Leaving you for higher concentration of medication in your body. So if you're consuming alcohol to get a medication, the liver is first going to metabolize that alcohol before the drugs that you're taking, the medicines that you're taking. And so the medication remains longer in your body. And if there are any unpleasant side effects associated with that particular drug, then the tendency to be affected by that is greater because the drug is in the system much longer. It will metabolize, but it will take a longer time to do that. And that is one of the reasons too where we say
No
timing.
alcohol
Well, no alcohol
when taking medication.
when taking medication, and timing is also very important where that is concerned. We also have changes in your diet. They can also affect how your body processes a drug. For example, the acidity of our stomach will determine how well certain drugs will be absorbed. So even doing something as simple as starting to skip breakfast, you decide you're going to cut down on, you're probably dieting and you're going to stop breakfast and probably take lunch or whatever. But continuing to take, if you're on a medication, you're continuing to take that medication in the morning that you're used to, even when you're having your breakfast, that could increase or decrease the amount of medication absorbed by the stomach, because the medication could be one that needs to be taken with food, for better absorption, right? So which means that the drug is going to remain much longer in the stomach because there's nothing for it to allow for the absorption of that drug. So depending on the type of medication you're taking, you have to bear that in mind. When we go over the medication list, a lot of patients, they also forget to tell the doctors about supplements that they take. So that is another factor, okay? Or even their pharmacists when they speak to them about the supplements that they take.
As far as they're concerned, that's not medication.
That's not medication.
Just some tablets, some tonic, some, vitamins.
Yes, it's just something, vitamins, so it's not a drug. But it is a drug. And many people think they cannot interact with the medicines that they're taking, so they don't talk about it. But they can, because they are drugs. When the patient normally is asked to list the different drugs that they take at the doctor's office, they have to make sure that they let them know, okay, well, I am on vitamin C or I'm on a one a day. What type of one a day you on, because there might be one or two constituents in there that might interact with what you're taking chronically, so you have to list those as drugs or medicines. The medicines, the supplements, and the over-the-counter drugs that you take on a regular basis, they can interact with your prescription medication. So don't start anything new if you are unsure after that discussion with your doctor listing that. You don't want to start anything new if you're unsure how that substance might react with your existing medication. So that's very important. So supplements are very important that can interact with other drugs and cause a slow process or an accelerated process as well, because they might interact with the other drug, and that can cause some unpleasant side effects. So supplements are drugs. When somebody tells you, okay, well, it's herbal, it's natural, it is a drug because you're consuming it. Is a foreign substance you're introducing into your body. And this is what a drug is. And it changes, whether in the good sense or the bad sense, the mechanism of the body. It helps with its functions, whether it's good or bad. So it is a drug. So always remember that. It's not that, it's a herbal product. It's not a prescription product. It is a drug.
Utan sa mami, vitamin la ou ka pon wa, c'est une médecine tout. Est-ce que pan comme ça, le wali oti docteur ni pou fè docteur savent ki ou ka pon, ki qualité vitamines ou ka pon.
Right on point.
All right, we'll take a short break now. Get a message from Quick Care Pharmacy. We'll be right back afterward from our sponsor.
Meet Moshe Zalbot, a retired Dominican who spent most of his working life in England but is now back home. Lewe Kumasi Palikot Quick Care Pharmacy, Anglais. His English flows straight from Mon Anglais to Mon Macaque. Edimo, I was have a sickness, but I was getting good medicine in England. So when I come here, I thought I was to die. But I uncover a place called Quick Care Pharmacy, Cote Halsborough, and I observe the whole thing about Quick Care Pharmacy is better health care for everyone. I get professional service and advice. Drug education is a pharmacy you can trust and put your confidence. I can talk about anything, no fear. I get quality products just like in England.